Heel pain. What causes it? What can you do about it? Stay tuned. Now, plantar fasciitis is one of the most common causes of heel pain. While heel spurs and plantar fasciitis are related, they are not the same. The plantar fascia is a thick band of tissue under the foot, and it connects your heel bone to your toes. If the tension in the plantar fascia becomes too much, you can develop small tears in it. The small tears lead to inflammation of the plantar fascia, and this is basically what plantar fasciitis is. Plantar fasciitis is essentially a repetitive strain injury. Plantar fasciitis usually presents as a sharp pain in the heel that occurs with your first steps in the morning, but subsides as you walk for a while. This is because the plantar fascia warms up and stretches with movement. This leads to reduced tension at the attachment point of the plantar fascia and the heel. However, you may feel it again throughout the day after long periods of standing or when you stand up after sitting for a while. Where exercise is concerned, the pain is usually worse after exercise and not during exercise. Plantar fasciitis is more common in runners, people who are overweight, those who wear shoes with poor arch support and cushioning. So, what are the risk factors for developing plantar fasciitis? People between the ages 40 and 60 are at greatest risk. Activities such as long-distance running, ballet dancing, and aerobic dance. Those with flat feet or high arches. Anyone with abnormal walking patterns which affect the way in which weight is distributed under the foot. Obesity, because the additional weight places additional stress on your plantar fascia. Occupations that keep you on your feet for a large part of the day, such as factory workers, teachers, and construction workers. Now, if you alter your walking pattern to compensate for the heel pain, you may develop foot, knee, hip, or back problems. So how is plantar fasciitis diagnosed? Plantar fasciitis is diagnosed based on the pattern of pain you report to your doctor, combined with the physical examination. Usually, no X-ray, CT, MRI, or blood tests are necessary. However, if your doctor thinks the problem is not plantar fasciitis, an X-ray, CT, or MRI, or blood tests may be needed to come to a diagnosis. Sometimes an X-ray may reveal a heel spur, but the heel spur is usually not the cause of the pain. Heel spurs are calcium deposits that occur due to an ongoing or chronic plantar fasciitis. But it is the active plantar fasciitis that is the actual cause of the pain. However, there are instances where the heel spur can be a source of pain if it grows large enough. But note, it is possible to have residual heel spurs and no pain at all after the plantar fasciitis has subsided. So, how do you treat plantar fasciitis? You can start with conservative treatment methods such as resting, icing the painful zones, stretching and massaging the arches and calves, and using anti-inflammatory medication if necessary. Additionally, a therapist can offer you massage, guidance on how to perform exercises, self-massage, and stretches. You can also add a night splint to stretch the plantar fascia while you sleep. Additionally, you can use shoe insoles that provide proper arch support and cushioning. Proper arch support helps the plantar fascia to absorb shock, which can help with healing and prevent a future recurrence. For home use, orthopedic slippers with arch support can be worn. A plantar fasciitis strap can also be used as an insole or orthopedic slippers alternative. The plantar fasciitis strap also helps the plantar fascia to absorb shock. Now, if the conservative measures aren't working, you can try steroid injections into the tender area to reduce inflammation. However, multiple steroid shots are not recommended because they can weaken your plantar fascia and possibly cause it to rupture. Now we come to surgical detachment of the plantar fascia. Very few people need surgery to detach the plantar fascia from the heel bone. It is generally an option only when the pain is severe and all the other treatments have failed. So, in summary, to deal with plantar fasciitis, you should maintain a healthy weight. Choose supportive insoles, shoes and slippers. Don't wear worn-out shoes. Replace your old shoes before they stop supporting and cushioning your feet. Alternate your exercise activity. Alternate high impact with low impact activities to give your feet a break. For example, alternate running with swimming. Stretch and massage your arches and calves on a regular basis. Thanks for listening, and feel free to send us your questions or type them in the comments below. Or call to book a consultation. We are in Chincuna Road in Cunupia inside Chincuna Gardens. Thank you.